Well, my friends, I do like to demonstrate this case. A child age about 5 years. বয়স কত তোমার? 20? 5. So, see, the child is very intelligent, but the disease is very severe. It is a case of granulomatous lymphadenitis. Granulomatous lymphadenitis. But in this early age, the child has developed a very severe and pathetic disease known as granulomatous lymphadenitis, a kind of lymphoma. The lymphatic systems of the body becomes inflamed and the lymph gland enlarged. The left-sided gland is very enlarged. The lymph nodes of the left-sided neck glands are very much enlarged in comparison with the right side. There is recurrent fever, intermittent fever, প্রায় জ্বর আসছে, with pallor, with anemia, with cervical adenitis, with splenomegaly. Spleen বেড়ে আছে. So, the child is suffering for last 4 years. It is non-cancerous, probably non-cancerous lymphoma, and for 4 years the child has been suffering. Patient was admitted in the medical college hospitals, diagnosed as hepatosplenomegaly and with this severe lymphadenopathy. Blood transfused. Marrow aspiration cytology was done at SSKM hospital. Bone marrow aspiration cytology was done at SSKM hospital in the year 2024 in the month of May. Again and again blood transfused due to severe anemia. In view of bone marrow aspiration report, the hematologists opined that this is a case of granulomatous lymphadenitis. The child was referred from SSKM to Medical College Hospital in the hematology department. There is severe pallor, vitals stable, per abdomen splenomegaly, also hepatomegaly. So final diagnosis is myelodysplastic disease, which is a kind of lymphoma. Hodgkin's lymphoma. The most common, now what is the cause of this disease? Generally, in practice of medicine, we have got the most common infectious agent is tuberculosis, Mycobacterium tuberculosis. But other bacterial infections or fungal infections or parasites or viruses can also cause granulomas, including aspergillosis. So this is a severe case. The management is severe. In allopathy, they are treating but without any good result or improvement. খুব একটা ইম্প্রুভমেন্ট কিছু হচ্ছে না, কোনো ওষুধ দিতে পারছে না, ডায়াগনোসিস সম্বন্ধে তারা সন্দেহান আছে। It is a good scope. We have good scope for treat the child. Now what will be our prescription? As it is non-cancerous, 4 years the child is suffering. But on further study and scrutiny, we have learned that at the age of 1 year, the child had an attack of severe skin disease that was treated by various ointments. So suppression of skin disease is a factor in this case at the age of 1 year, and since then the symptomatology developed. So suppression of skin disease is main factor, and bathing aversion and desire for sweets, we may think of the medicine sulfur. বেদিং আবার চান করতে চায় না, খুব একটা পছন্দ করে। মিষ্টি ভালোবাসে, মিষ্টি ভালোবাসো, রসগোল্লা রসগোল্লা ভালোবাসে। সো সালফার ইজ দ্য চয়েস অফ মেডিসিন। আবার অন্যদিকে যদি দেখি, রেকারিং ফিভার, দ্য পজিটিভ অর্গানিজম ইজ টিউবারকুলোসিস, ফিয়ার অফ অ্যানিমালস, স্পেশালি ডগস, catches cold very easily, a serious disease, fear of animals, the medicine may be tuberculum. Now, this is the fine thinking of us, what we will do. This is a question of million money, the what will be our first prescription, tuberculum or sulfur. The child is very intelligent enough, catches cold very easily. This is probably due to tubercular infection. We may think of tuberculum. Considering a period of time, a thinking of consideration, a thinking of my choice is to first prescribe tuberculum. If there may be any hindrance or lack of progress of the disease symptomatology, we may think of the positive and miasmatic medicine sulfur. So let's prescribe at first tuberculum. Tuberculum is not found in 50 millisimal scale of potency. It is found in, the basilinum is found in 50 millisimal scale of potency. As I believe, there is no much difference about these two medicines. There is not much enough difference between these two medicines, as 50 millisimal is available in by basilinum, by HAPCO. So let's prescribe basilinum in 50 millisimal of potency. And not only that, in the family history, father suffered from tuberculosis. So tuberculosis and sulfur is running fast, running equally 50-50. So on consideration, let's prescribe basilinum at first, because the fever is going on, catches cold very easily is going on, the child is very intelligent and sharp, fear of darkness, the father suffered from tuberculosis. So let's prescribe tuberculum. Let's prescribe tuberculum. বলো।